Recording. Testing. Yep, okay, it's working. Yep.
1, 2, 3.
Hi, everyone, and welcome for being here today. As a part of my subject, Clinical Teaching and Workplace Learning for Competent Practice, one of the requirements was to develop this presentation to you. I appreciate your time and look forward to sharing what I've learned and discussing key aspects of clinical teaching and workplace learning with you. This is the next slide. I've also got Natalie and Priscilla here, so thank you.
Hello. Hello.
So the aim of this presentation is to apply the knowledge of the clinical teaching approach and learning theories in which I presented earlier in assessment 1 and develop a further learning activity for a future teaching project. Okay, an introduction. So the topic I have chosen for this presentation is investigational product in clinical trials, with a focus on creating an effective learning activity around it. I selected this topic because of my extensive experience as an oncology nurse and senior clinical trial coordinator, which positions me as a subject matter expert in this area. Through my daily work in clinical trials and patient care, I've consistently seen that many new and even experienced staff lack thorough understanding of the critical responsibilities related in managing the investigational product. This training module is designed to bridge the gap by providing an in-depth knowledge based on real-life experiences. The goal is to prepare clinical trial coordinators with an insight needed to manage the investigational product safely and in full compliance with regulatory standards. The next slide. So for an overview, I've chosen my learning theory as well. I selected cognitivism as the most appropriate learning theory because it highlights how learners process, organize, and retain information. This theory aligns well with my lecture style session, which is designed for experienced professionals who already have a strong understanding of the topic. Cognitivism supports effective learning by introducing new information, concepts, ideas, and procedures that can be linked to prior knowledge, as it focuses on individuals' internal thought processes. This type of learning cannot be directly observed and instead associated with changes in a person's ability and capacity to respond. By thoroughly structuring the content and encouraging learners to connect new concepts with their existing expertise, this approach facilitates deeper understanding and promotes long-term retention. Additionally, incorporating interactive elements such as targeted questions and brief discussions will engage learners cognitively, further reinforcing the learning process. Overall, cognitivism provides a solid foundation for delivering complex information efficiently while supporting learners' ability to adopt and apply knowledge effectively in their professional roles. Slide. So here we're going to compare and contrast. So there are various role forms of learning theories, but to give you an insight to why I chose cognitivism for my training presentation is because it best supports the structure, which is the lectured style format, which I'm currently using. While other learning theories have value, they were less suited to my specific goals. We have behaviorism, for example, focuses on stimulus response learning and is better for procedural or repetitive skill-based training, which isn't the aim of my session. We have constructivism, which encourages hands-on learner-driven exploration, which works well in workshops, but not as much in lectures, although I did include some reflective elements to support personal connection. We have social learning, which relies on modeling and peer observation, more suited to mentoring or hands-on training. And we have the humanistic theory, which emphasizes personal growth and autonomy which is ideal for coaching, but not for structured content delivery. Lastly, connectivism applies more to digital and network learning environments, while my presentation is delivered in personal, but with minimal reliance to digital learning. In summary, cognitivism is the most appropriate theory for my training context because it supports the structured, lecture-based delivery of information to an audience that already has existing knowledge to build on. While I have drawn from elements from other theories to enhance engagement and reflection, cognitivism best aligns with my training goals, format, and the audience. So going into the rationale, whoops. There we go. So the learning activity is structured as an interactive training module, utilizing visual aids through a PowerPoint presentation with an incorporated group problem-solving component. This design facilitates active engagement with realistic clinical trial scenarios involving oral and intravenous investigational product. The content is specifically tailored to address identified performance gaps from prior errors, with a focus on process, procedures, and documentation essential for the safe handling, accountability, and patient compliance of IPs. By promoting collaboration and reflective practice, the module enables my peers to develop meaningful, practical knowledge that extends beyond theoretical concepts. Evaluation. As highlighted in the overview slide, this form of learning is not directly observable, but can be gathered through changes in the learner's competencies and behaviors. While there are several post-learning evaluation tools available, their focus may vary depending on whether the learning is assessed as a holistic approach or through specific outcomes. To assess the effectiveness, learners will complete an evaluation form after this session to measure the knowledge gained during the group activities. I will also observe my peers' problem-solving and application skills to gauge practical competencies. Participants' feedback surveys will also capture their perception and experience of the overall training. In addition, follow-up audits of IP handling procedures, such as reviewing the site's oral IP log, will monitor adherence in clinical practice and help identify any training needs. What impact does it have on patient outcomes? So by enhancing clinical trial coordinators' understanding and practical skills in the management of investigational product, this training directly mitigates the risk of errors that could jeopardize patient safety. Improved compliance with good clinical practice and regulatory standards ensure that ethical conduct of clinical trials is safe and safeguards trial participants. Ultimately, this increased competency contributes to safer trial processes, more reliable data collection, and improved patient outcomes. That is it. Before we conclude, do you guys have any questions? So that has come to the end of the slide.
Yep. So just wanting to know, like, why did you pick cognitivism?
Why? I picked cognitism because the learning theory is a process of connecting new information with a person's existing knowledge. Therefore, it is an extension of what they already know or what they should already know. So by elaborating further, if it's either to foster active engagement or critical thinking, will help deepen the understanding for the learner and help understand the content, I hope. Natalie?
Yeah, if you weren't going to choose this learning theory, what else would you think would work? Well,
Good question.
or what would be like your next voice?
I think I'd probably go with constructivism. Why I say that is because learners develop their own understanding through this learning theory. So they're able to develop their own understanding and knowledge through their own experiences because the process is driven by integrating new information into existing prior knowledge, but through social interactions. Therefore, it's on a more personal note. So, for example, our role is clinical trial coordinators. So the clinical aspect of it would be is when we're in the clinic seeing our patients. We're completing the oral accountability and compliance through the use of the site's oral IP log. So I guess the more practice you have with that, the more you can connect the theory to the practicals. And I guess and I hope that'll help retain that information that we want from our coordinators.
Thank you.
Yeah.
What was the event that led to you developing this training?
Yeah. Okay, good. So in December 2024, without going into too much detail, there was an error that occurred between multiple departments. So between our pharmacy, which was then passed over to the clinical trials unit, where a medication was, or an incorrect medication was, or a dose was given to the patient. So could we have prevented this was the question. Yes, we probably could have. So that incident did lead to a CAPA, which is a corrective and action preventative action plan. A part of the CAPA was to retrain all our clinical trials, not only our coordinators, but our entire clinical trials medical oncology team on IP handling and administration and accountability, which is why then we have developed or created this module, which is actually in progress at the moment, to be delivered. So hopefully we can help improve the processes moving forward.
What would you say was the challenges of delivering this module using cognitivism? Or just delivering the module?
Delivering the module? Yeah, good question. So the biggest, I guess, challenges I had was getting everyone on board. So a lot of our clinical trial work is very independent. So getting just the clinical trial coordinators together, getting the doctors together on board with what is required from the CAPA and mandating this training. This training is, unfortunately in person. We do have very flexible working arrangements here where, people work from home. So one of the biggest one was organizing a time to get everyone together to do this. And what the coordinators get out of it is the mandating of the use of the oral IP log moving forward. So having the coordinators understand what the process is moving forward, and we'll be auditing that through their work moving forward once this training is delivered. Yeah.
So it sounds like you had to sort of adapt to a particular format because of how all the other modules are delivered in the unit.
Yeah.
If you had a choice, like what would you think would be the best way to teach this particular topic to people, like in nursing? What would you think is the best way?
So for our clinical trial coordinators, it would be this training module with the group activities to get them into the rhythm and understanding, and have them involved more in a practical process, I guess. Whereas for the nurses, they are very hands-on, and with the time capacity they have on the wards for them, it would be very hands-on. They'll be the ones administering the drugs at the end of the day. So the checks they need to do and the oral IP logs, even though it doesn't relate to the nurses too much. I guess understanding what the process is and that every oral medication should have an oral IP log for when the patients come in to the unit. Oh, does that make sense? Does that answer your questions?
Thank you.
Oh, God, thank you. Before we conclude, though, I just need to give you guys a feedback form.
Yes.
And if you can fill this out for me, I will greatly appreciate your time and your effort towards this. So pass it over to you.
Thank you.
Thank you. And I'll stop.